the world's most dangerous cosmetic surgery. Who doesn't love to look beautiful and feel confident about their body shape? It's a myth. Your inner beauty will help you chase the sky, not your body shape. But the harsh reality is in our society, especially women, are conditioned to look good. There is so much pressure to look good or perfect, and as a result, it causes emotional distress and an immense amount of self-loathing. That's why cosmetic surgery stems from low self-esteem and non-acceptance of us. But the creation of a fake version of yourself through aesthetic procedures can be the deadliest for you. Today, we're going to show you which cosmetic surgery is the most dangerous. So don't skip the video and please hit that subscribe button to stay tuned with our channel. Let's get started. The Brazilian butt lift is a cosmetic procedure that involves the transfer of fat in order to augment the size and shape of the buttocks without the use of implants. The procedure, which can cost more than $10,000, was pioneered by the Brazilian doctor Ivo Pittengai. But how does this operation work? The whole procedure works in two parts. First, the surgeon will retrieve the fat, which is known as harvesting, and then they'll inject the fat into your butt in order to create the desired effect, grafting. In the harvesting process, the surgeon will begin to make small incisions on the harvest sites so they can retrieve the fat, and harvest sites are discussed beforehand, and they usually include your stomach or thigh area. However, the fat is not immediately grafted, but it is processed so that anything that can compromise the grafting process and debris, dead cells, are removed. In the second part, your surgeon will now inject the harvested fat into the desired areas of the buttocks. However, the amount of fat they inject will depend on the requested size and shape. So the procedure involves taking fat from areas of the body where it's not wanted and transplanting it into the glutes to enlarge them and to be successful. So a fat graft needs nutrition and has to be injected into tissue that has a blood supply. However, scientifically, fat can survive if injected into other fat, but up to 90% of it can be absorbed, and fat has more of a chance of staying in place if it's inserted into the muscle. But this is where the risk lies. Actually, injecting fat into the buttocks can easily lead to serious problems if done incorrectly. These include a fat embolism, when fat enters the bloodstream and blocks a blood vessel. In the lungs, for example, it blocks oxygen from entering the bloodstream, while in the brain, it can cause a stroke and can be fatal. Besides, the volume of fat is also important. Most surgeons consider 300 milliliters, which is slightly less than a can of soda, to be a safe amount. However, some more experienced surgeons use a much larger volume of fat that can be measured in liters. But due to this ill treatment, the mortality rate of the surgery is high, and fat embolism was recently identified as the leading cause of death in aesthetic surgery. The estimated death rate from fat embolism may be as high as 3,000 for BBLs. A 2015 study of deaths from the BBL surgery concluded that they probably occur as a result of gluteal blood vessels becoming damaged during the procedure, allowing fat to enter the bloodstream. Again, a 2017 survey of 692 surgeons from across the world investigated the rate of mortality among patients undergoing Brazilian butt lift surgery. Throughout their careers, the surgeons reported 32 cases of death from a fat embolism and 103 non-fatal cases. But there are probably many more that remain unreported. As it has so many risks, is it really necessary to go for such fatal surgery? Actually, the potential risk of death from a fat embolism has to be weighed against the benefits, especially in this case, where there are physical and functional benefits to having the surgery. In the case of the Brazilian butt lift, perhaps the risk outweighs the benefits. Nevertheless, in a celebrity and beauty-obsessed society, the procedure remains popular despite the risks. So it is important that surgeons make the risks of the procedure very clear to anyone considering it. Moreover, patient safety should always be the top priority, and surgeons need to do more to increase the safety of the procedure and lower the unnecessarily high mortality rate. So viewers, we hope you enjoyed today's video on why and how the Brazilian butt lift is known as the most dangerous cosmetic surgery ever. Please subscribe, like, and share, and always be with us for the next video.